So let us start next topic, that is various other drugs which are used. So far what we have seen is, we have seen about bronchial asthma, what are the reasons, what are the etiological factors, and emphysema, what are these, and what are the various drugs, how we classify the drugs, what are the pros and cons about this. So next to this is, after studying all the drugs which are used in bronchial asthma and emphysema, we are going for the next, that is various coughs and various drugs which are used in various such situations. So what is cough? It is a protective reflex. It is intended to remove the irritants and accumulated secretions which are there. You might have studied this in physiology of respiratory system. What is it? This is cough is a sort of reflex, and this reflex is propelling out the irritant which are there, which are supposed to be there. There are two types of coughs we know. One is productive cough, and that is having the sputum, a thin sputum, which is not very very viscous, and it helps to clear the airway, and if we try to suppress it, it is harmful, and it may lead to infection to that, because that will accumulate it. The another one is non-productive cough. It is a useless cough, and it should be suppressed. So these are two basic ideas, basic information about cough, so that accordingly we can have two types of drugs for that. The drug which has to be easily expelled out, we call them as expectorant, and the drugs which are used to suppress, we call them as a cough suppressant. These are two different types of drugs which are acting on productive cough and non-productive cough. So next to this is, there are various preparations which are used in various cough situations. These are antitussives, expectorants, mucolytics. We shall study one after another. So what are these antitussive agents? We call them as a cough suppressants, and they are also called as a central cough suppressants. They are acting on the cough center, and they suppress the cough center, and by that virtue they are acting. The drugs which are used in these are codeine, folcodeine, it is analog of codeine, noscapine, dextromethorphan, various antihistaminics, and benzoate. You will see that most of these, like codeine, folcodeine, noscapine, and dextromethorphan, these all are actually called as opioid analogs. We shall see about these drugs, and these are the opioid analogs which are used into this. Others are antihistaminics. Recently we have studied autocoids, histamines, and antihistaminics. So these antihistaminics are used, and benzoate. These are various drugs. Then other one is pharyngeal demulcents. They causes soothing effect on the pharyngeal area, which is because of the cough. There is inflammation and there is irritation. So this demulcent will give a protective layer type of thing, and they will give the soothing effect. So for that there are lozenges. Example, you must be knowing the tablets like Strepsil, Vicks, etc. There are various Linctuses are there, and licorice is very popular household remedy, what is called as a Jestmad in Marathi. So these are the pharyngeal demulcents. They are giving a soothing effect, they reduce the irritation, and thus they are helping. Then next one is expectorants. So they are the agents which expel out the cough, and example of these are sodium and potassium citrate, potassium iodide, guaifenesin, ammonium chloride, etc. Then other agents are known as mucolytics, that is bromhexine, acetylcysteine, carbocisteine, and ambroxan. So these are basically four type of agents which are used in various kind of cough situation. Here cough means the whatsoever reflex is there along with sputum is coming out. This is what we call as a cough. Then next into this is antitussives, the first kind of drug. We have seen these 4 classes: antitussive, pharyngeal demulcents, expectorant and mucolytics. So we shall be studying this drug one after another. First are antitussives. So these drugs, what is their action? What they do is they are causing inhibition of cough reflex, that is cough reflex is inhibited by suppressing the cough center in the medulla. So in medulla oblongata there is a cough center, and this cough center is suppressed or inhibited by these agents. They are used for symptomatic treatment for the dry and unproductive cough. This is very important. So cough suppressant we are using only in dry and unproductive cough. Okay, because productive cough is easy, that is helping. So we do not suppress it. So dry cough means which is not having sputum coming it out. It gives us irritation. In that cases we are using it. Then the drugs in that is, first is codeine. So it acts on the cough center. It suppresses or it causes inhibitory effect on the cough center. It has called mild CNS depression. The person will feel depressed. Here depression means the person will feel sleepy like thing, that is called as CNS depression, and the CNS activity will be reduced. Then it can cause constipation by decreasing intestinal movement. It should be avoided in children and asthmatics. It is administered orally. It is having mild analgesic action, and it causes comparatively less addiction. When we say that addiction, that means reason is basically codeine is from the class of the drug. We call them as opioid agents, that is which are acting on the opioid receptor. Opioid receptors are the receptor which are present in the central nervous system, on which the opium was acting. So in opium the main drug is morphine, and so the drug the receptor where the morphine is acting, this type of receptor they are called as a opioid receptor. We shall study this receptor when we shall study in CNS, but just for your information that these receptors, these are having variety of receptor, that is known as a mu receptor, kappa receptor, delta receptor. So these are various receptors, and these are present in cough center also. So these are opioid analgesics are acting on these receptors, various receptors, and they causes suppression of or depression of it or inhibition of it. So because of this inhibition, this codeine will acting as a cough suppressor, and this is used in the treatment of dry and productive cough. There are this, as we have seen, what are the basic characteristics of this. It causes mild depression, is not welcome one, because for cough if we take any medication and it produces sleepiness, so there may be students you can understand about it. Example, cough suppressant medication are taken and the person is feeling sleepy during daytime. Okay, anyway many students remain sleepy during classes, but those who are working, that can be a problem for them, isn't it? Those who are driving, if somebody is sleepy or feeling sleepiness or depressed, then driving skills, or if they are operating some important machines, they may not able to operate. So this kind of agents which are causing CNS depression, they have to be given with the caution. If they are very essential, very much required, then only given, and they are given with that warning that if these medications are being taken, the person should not drive or should not do important work. Then it can cause constipation. These are all because of the opioid receptor activities. It should be avoided in children and asthmatics, and it should be administered only orally. There are mild analgesic activity, and it causes comparatively less addiction. When we compare it is with the morphine. Morphine is having more addiction. What is addiction? Without this, we have seen two types of addiction: physical addiction and psychological addiction. So because of that, body feels that without it, the body cannot do, and it demands. If it is not given, then body will show very disturbing signs and symptoms. and that will force the person to take it again. And once the person starts taking it, the person cannot stop taking it. So this type of phenomena is called as addiction. It is having comparatively less addiction than morphine. Morphine has got very high addiction rate. Then next in this is various other antitussive agents. Then other derivative of codeine is folcodeine. It is similar to that of codeine, but it does not have analgesic activity and it has no addiction liability. It is also administered orally. It has long duration of action. Now here when we have seen these two, no analgesic, no addiction, but others are similar. That means it can cause cup suppression as codeine. It can cause the central nervous system depression similar to that of codeine. Then next is noscapine. It is also opium alkaloid. I told you these all are opium alkaloids, and opium basically is taken for morphine, or morphine is the main, and therefore we call them as a drugs which are acting on opioid receptors. So noscapine is opium. It has got potent antitussive effect. It is useful in spasmodic cough, where the spasmodic means where there is a spasm of respiratory tract, that is when the respiratory tract is getting too much contracting fast, or the tone is too high. So this type of cough, this noscapine is, it has no analgesic effect, it does not cause constipation and CNS depression or addiction. Now you can realize which one is better, codeine, folcodeine and noscapine. All are acting on similar, but noscapine is potent antitussive. We want it for antitussive, so this is benefit. It is useful in spasmodic cough. It is additional, which was not there in earlier two, codeine and folcodeine. It does not have analgesic effect. That way, it is not that beneficial. But we may not need analgesia during, because there is no pain, so we do not need it. It is not a big loss, but it does not cause constipation. It does not cause CNS depression, or it does not cause addiction. These are the biggest advantages the noscapine is given, and therefore noscapine can be definitely preferred over codeine or folcodeine. Side effects are nausea and vomiting. Then next is dextromethorphan. It is same. It is also synthetic opioid. It is centrally acting antitussive agent. It has no analgesic property. It does not cause constipation and addiction, and mucociliary reed functions are not affected. So this is beneficial, and you will find that in most of the cup preparations, dextromethorphan or these agents are there. There are many antihistaminics are available, like diphenhydramine, chlorpheniramine, promethazine. Here we call them as a generation 1, generation 2. I hope you might have studied after autocoids. But these are agents like diphenhydramine, chlorpheniramine, promethazine. These are the earlier one. They are useful in the cough because again here histamine plays important role in cough. It is irritation, it causes constriction, and because of that these reflexes, cough reflexes stimulated. So these agents are having various effects, but problem is they are sedative in nature, they are anti-allergic. So when allergic cough is there, in that this antihistaminics, they play a very important role, very beneficial. And some of these, not all, some of these antihistaminic agent also having anticholinergic effect. These are the adverse effect. What can be the impact of the anticholinergic effect? Because you have studied ANS. If any drug is anticholinergic in nature, what will happen? We have seen it many times. You take many times. These all anticholinergic effect. That means cholinergic effect causes secretion. Anticholinergic means no secretion. So decrease in the salivary secretion. We call it as a dryness of mouth. Okay, it is having action on urinary bladder. So anticholinergic effect will affect the urination. So similarly, all these various effects will be there because of the anticholinergic effect. So what's your side effects or what's their effects? You will find atropine, similar effect this drug will show, but atropine is a potent anticholinergic agent. or it has got only that action. Here they have, these agents are milder comparatively, and therefore the effects are not that big, but similar effect in a small amount, or for short duration of time we can see. They can produce symptomatic relief in cold and cough, which is associated with the allergy condition, as I told you, of the respiratory tract. The next of the agent is known as a benzonatate. That is, it is a peripherally acting cough suppressant, and it is chemically related to local anesthetic procaine, and it acts on the pulmonary stretch receptors. So whenever there is inflammation, these stretch receptors will be stretched, which causes cough suppression, which causes stimulation of the cough center in the middle of lungetta. So if we block it from the pulmonary, then we can decrease the cough response. So these are all antitussives. Basically, as we have seen, we call them as a cough suppressant, and because of this cough suppression, we are using it in a non-productive cough or a dry cough. So this has to be remembered, which are the good remedies in a dry cough. So these are only the good remedies in dry cough. So what are these agents and their preparation we can have? That is codeine phosphate, codeine, dextromethorphan. It is combined many times with promethazine. Diphenhydramine is antihistaminic. Promethazine is also antihistaminics. Next type of drugs are pharyngeal demulcents. So what these drugs are causing? They are producing the protective soothing effect on the inflamed mucosa. So whatsoever mucosa is there, and that has got inflammation because of the cough. So these are causing protection. Particularly some infection is there, or some allergy is there, which is causing irritation above larynx. So that means almost upper portion of the this respiratory tract near pharynx area, very close to pharynx, above larynx means, okay. So they are used when cough is arising due to irritation above larynx. They are increasing the salivation. They produce protective soothing effect on the inflamed. Examples of these are syrups, lozenges, linctuses, or licorice. You must be knowing what lozenges means, or what linctuses means, and what syrup means, because these are basically covered in pharmaceutics. Everything you must be knowing about this. So these are many such simple syrup can be helping, or warm water it can be helping. Lozenges, I told you, these are the chewable tablets. Example, I told you, like Vicks and Strepsil, etc. These are the chewable there. And linctuses are alcoholic preparations, and licorice as a whole, that particularly part of licorice can be taken, and it can be chewed, and whatsoever secretions are coming, this will cause covering on that inflamed area, and that will cause soothing effect, just like in cold cream or something cream you are applying on the winter season. So this type of, and it gives some cooling like effect, some soothing like effect, feeling good. So this type of protective covering it will be producing, and these are called as a pharyngeal demulcents. Then next is expectorants, or we call them as a mucokinetics. These are the drugs which causes increasing the volume of bronchial secretion, and they reduce the viscosity of sputum. What is happening many times is sputum becomes very thick, and that gets trapped in the smaller bronchi, and the secretion is going on. The secretion should be there because it helps to remove the irritant material, so secretion should not be stopped. But the problem is, if it is thick, then it gets stuck over there. It is not easy to remove that, and in that cases we should have drugs which can easily expel it out. So these are the drugs which are expelling the mucus easily, and therefore we call them as expectorant, because they are for they are expelling the sputum, particularly thick sputum. So what are the effects of this? They increase the volume of bronchial secretion, and while increasing the volume of bronchial secretion, because if the volume is small and it becomes thick, stuck to the bronchi, then it is difficult, it is not coming out. And many times if the volume is less, it is more viscous, and that causes problem because it causes obstruction. So these are the drugs. Example of these are many, we shall see them. But how they do it, how they do the job of expectorant. So this is, they increase the volume of bronchial secretion, they causes reduction in the viscosity of the sputum, and the cup becomes less tiring and less productive. It includes iodides, chlorides, bicarbonate, acetates, and various volatile salts. They are used in chronic cough. Then next type of drugs which are used in these are called as mucolytic agents. These agents break the thick sputum, which is very thick and tenacious because of too much viscosity. It is the person finds it difficult to remove it. So because of this mucolytics, this viscosity of sputum will be lowered, it will become less. The sputum comes out easily with less efforts. Example of this is bromhexine. This bromhexine, the mechanism is it causes liberation of lysosomal enzymes. This lysosomal enzyme will digest, or it will hydrolyze the mucopolysaccharides. So this will be, mucopolysaccharides will be metabolized, and thus they will decrease the viscosity of sputum. What are other side effects of these are rhinorrhea and lacrimation. Rhinorrhea means the watery nose, the watery fluid, or from nose very watery secretion will be there. And lacrimation means the from eyes lacrimal secretion will increase. So these are two major, tears will be increasing from eyes, that is lacrimation. So these are two side effects, that it will increase the lacrimation and it will cause secretion or watery secretion from nose. We call it as a rhinorrhea. These are the adverse effect, and otherwise bromhexine is used. Then other mucolytics are acetylcysteine and carbocysteine. These are used as aerosol in treatment of cough. These are having acetylcysteine, you must be knowing this is amino acid, and this cysteine is particularly is having amino acid with sulfhydryl group, SH group is there. So what they do are, they are opening the disulfide bond in the mucoprotein of the sputum. So whatsoever disulfide bond is there in the mucoprotein, that is broken. So because of that, the gel-like formation of sputum is there, which is very thick. Because of breaking this bond, that will become smaller molecules of mucoproteins, and thus the sputum will become less thick, or it will become more thinner. Side effects are nausea, vomiting, and bronchospasm. Carbocysteine can be administered orally, and acetyl is given in a what we can say aerosol form. Then various cough preparation. We have seen antitussives, they are suppressing cough. Some are acting within the CNS, while we have seen benzonatate, which is acting peripherally. These are indicated in dry, hacking, non-productive cough that interfere with the rest and sleep. And most of these we have seen they are producing drowsiness because these are the opioid agents. They can cause respiratory depression, particularly the opioid one, codeine-like agents. Some of these are producing constipation, except noscapine and dextromethorphan, they are producing constipation. And these are not generally recommended in children and should be avoided in the patient under age of 1 year. And what can be done, that the excessive suppression of cough reflex is not a good thing, because this is important, and it is a potentially serious adverse effect, because this secretion, it may lead to lung collapse, because what we are doing is we are suppressing the cough center, and because of that cough center, even though it is from respiratory tract, the message is going to cough center that something is obstructing or there, but cough center, and for that cough is the mechanism to expel it out. but then it will not allow because it is depressed. So in that cases, it can lead to problems like lung collapse, pneumonia, hypoxia, hypercarbia, that is increase in the carbon dioxide, and respiratory failure. So this has to be used with very big caution. These are not that safe. Then expectorant, what we can do, we have seen what are there. They become more productive. It stimulates the flow of respiratory tract secretion. Guaifenesin is the most commonly used agent as an expectorant, in addition to various inorganic compounds. You must have studied all these inorganic compounds in inorganic chemistry. These are various citrates and such molecules. The ammonium chloride and these various molecules, these are all inorganic molecules. And guaifenesin is a popular one. This can be given alone or as an ingredient in the various cough and cold remedies. They are there. Guaifenesin is around 100 to 400. Then ammonia and ipecac mixtures can be given 10 to 20 ml 3 to 4 times a day. Then we have seen mucolytics. What they are doing is they are breaking down mucus, which is thicker, and that will become cough more productive. It can be easily expelled. So example, we have seen about acetylcysteine, bromhexine and carbocystine. These are various agents, and these are various doses, that is 100 mg, 200 mg, 600 mg. Bromhexine is 8 to 16 milligram thrice a day, and carbocystine 750 milligram. Then next category, this we have revised. Next category we find is nasal decongestants. So many times we find that the nose is congested, and because of that one cannot breathe properly, and it is sometimes very difficult to remove this whatsoever secretions are there in the nose. They stuck up and they find it very difficult to remove. They cannot be easily removed. So what are the drugs which are used? We use the sympathomimetics for the reduction in the nasal congestion. Particularly we use selective alpha-1 agonist for nasal blood vessels, and this causes vasoconstriction. You know alpha-1 effect. So those which are having alpha-1 effect, they are preferred, they are used in this nasal decongestion. They causes vasoconstriction, they causes shrinkage of the solar membranes, and because of that these agents are having effect as a nasal decongestants. Then we have various kind of antihistaminic we have seen. They are used in allergic conditions, maybe nasal allergic, then seasonal allergic rhinitis. Then it reduces the rhinorrhea, that is I told you watery secretion from nose and sneezing, but they are less effective for nasal congestion because the secretions are still going on. They are also topically used in eye, in the nose and on the skin for various histamine or allergy related conditions. So we have got various classes of it, first generation, second generation. First generations were non-selective, and they were causing, non-selective means along with H1 blocking, they were also having sedation action because they were crossing blood-brain barrier, and they were also acting as an anticholinergic agent and many activities simultaneously. They are also able to inhibit or block the CTZ, that is chemoreceptor trigger zone, and because of that some of these are also used in the vomiting. So they will bind central and peripheral H1 receptors, and they causes CNS depression. Because of that it causes drowsiness, it causes sedation. And see, whatsoever drug which are you given for very simple purpose like cough or cold, and they are causing CNS depression, then problem is the people cannot go for very skillful work, because feeling sleepy during driving, feeling sleepy during important work, that can affect the work, and therefore this should not be given. Then they are also having, as I told you, anticholinergic effect they have, and these are the first generation. Example of this first generation are chlorpheniramide. It is available as a chlorpheniramide maleate, very popularly called as a CPM, chlorpheniramine maleate, is there. It is present in many preparations. Then hydroxyzine, then diphenhydramine, it is again very popular one. It is also present in many preparations. Then promethazine, then azatidine. These are various antihistaminic agents which are present in many preparations. So these are there which are particularly first generation were they causes sedation, they causes dry mouth because anticholinergic effect, blurred vision again anticholinergic effect, GI disturbances anticholinergic effect, headache because of multiple actions, H1 receptor and anticholinergic, urinary retention. I told you all these adverse effects, these are related to the anticholinergic effect. And hydroxyzine is not recommended for pregnancy and breastfeeding because it causes impact. Then another kind of antihistaminics are there, we call them as a second generation H1 receptor antagonists. They are comparatively more selective and therefore they are comparatively non-sedating. These are both advantages they are having, and since they are non-sedating, they causes less CNS depression because they are selective only for peripheral H1 receptors and they do not cause blood-brain barrier. They are comparatively acting longer than first generation and therefore they are most preferred one nowadays. Example of these are acrevastin. Cetirizine is the most popularly available medication nowadays. Then desloratadine, fexofenadine and loratadine. These are the newer one. These are the what we can call it as a generation 2. There were few more actually. This fexofenadine is the congener, or it is the analog from the earlier drug that was known as a terfenadine. But terfenadine is found to be having many adverse effects, particularly it can cause some cardiovascular complication in people and even lead to death. Otherwise the drug is good, it was safe, but in few people it may cause cardiovascular and therefore terfenadine is removed, and its an other analog like fexofenadine is available. Similarly loratadine, if you remember, we have seen various chemical analogs if you have studied chemistry. Then we have seen various chemical analogs of it. We call them R and S congeners, levorotary, dextrorotary. Similarly RS conformations are there. So or D conformation, levo and dextrorotary. So here desloratadine is its analog and loratadine. So these are various antihistaminic agents which are used, and they are comparatively more popular than the older one. So this second generation will cause a slight sedation. They will not as sedative as generation 1. Then some of these may interact with the antifungal agents like ketoconazole. Particularly this was the problem with terfenadine. Antibiotics like erythromycin, then prokinetic like cisopride or some other things, and they will cause. So I told you about terfenadine. So this was a terfenadine, and therefore terfenadine is no more marketed in anywhere. It has been removed from therapeutics. So this is the reason why terfenadine is not working, and its other analog like fexofenadine they are used. Then so we have seen various classes, that is anti-tissues, expectorants, mucolytics. We have seen that they are suppressing cough, they act within CNS and peripherally, and I think this become repeated. And these are various effects the agents are having. I think this has got repeated. Yes. Then nasal decongestant we were actually discussing. So these are the sympathomimetic agents. They are used to reduce nasal congestion. They stimulate alpha-1 receptors and they are topically administered. Example, that is, they are topically administered. The response is rapid and intense. Orally they should not be given because response is less, moderate, and it will become prolonged. And another problem is it will cause overall problem, hypertension. So these are the drugs. Example of these are oxymetazoline, xylometazoline, and phenylephrine. Phenylephrine, you have seen it earlier during ANS. It is alpha-1 agonist and it causes very powerful alpha 1 effects like vasoconstriction. Similarly, oxymetazoline, xylometazoline are there. They are very popular as a nasal drops, and they are used for nasal decongestion. As I told you, mechanism of action is same, that is they are alpha 1 receptor agonist. Because of that, they will cause vasoconstriction in the nasal arteries. Because of these nasal arteries which are constricted, because of this constriction of nasal arteries, it will produce the decrease in the secretions, because it will reduce the blood supply to that nasal mucosal area. Because of that, if the blood supply to that area is reduced, then it will cause decrease in the secretion formation. So all this mucous secretion will be decreasing, and thus it will prevent, or it will decrease the whatsoever secretions are there from the nose. So what are the adverse effects? It can cause rebound congestion after topical use, when it is used for more than few days, because of the reflex actions. The CNS stimulation like restlessness, irritability can occur with oral sympathomimetics. And most important adverse effect is it can cause, or it can increase the hypertension and all related hypertension related. That means if it is angina, then it will increase the afterload. So these are the all problems which are there, because you can think about it. We have used antihypertensive agents for cardiac failure. We have used it in angina pectoris. We have used as antihypertensive, and all these drugs are prone this nasal decongestion. They are acting as alpha 1 agonist. Because of that, they can cause vasoconstriction, and they are causing actually vasoconstriction. But if we are using it in a systematic way, if they are given as a tablet for whole over body, then they will cause hypertension. So these are the problem they are having. So this vasoconstriction will be there. It will be more common with the oral agents. I told you now. Symptomatic, they can cause CNS stimulation, particularly which are crossing blood-brain barrier, and they will produce effects similar to that of amphetamine, and hence these drugs should be used with the caution, or they are the drugs of the abuse. Already we have seen it can cause nasal. If the patient those hypertensive patient, it should be given with caution, and the dose should be restricted in the patient with that. Then next type of the drugs are the intranasal corticosteroids. These are the effective for the treatment of seasonal and perennial, means in year, particularly during season change. It is there, that is called as a rhinitis, that is inflammation of nasal mucosa. It has got inflammatory actions, and it can prevent or suppress all major symptoms of allergic rhinitis. It includes congestion, rhinorrhea, sneezing, nasal itching, and erythema. So we have seen this corticosteroid, we have seen the mechanism when we have seen bronchial asthma, but here we are using it as an intranasal, because we are limiting our action to only nasal secretions. So they are there example of this, which can be given intranasal, or beclomethasone in nasal spray, or in different ways it is given. Then budesonide nasal spray, then fluticasone or mometasone. These are all nasal sprays, and the doses are same, 50 microgram for each. Adverse effects are mild. Most common side effects are drying of nasal mucosa and sensation of burning or itching. These are the most important adverse effects these agents are having. So this is what about various other drugs which are used in or which are there in treatment of other nasal conditions. Here we finish topic of respiratory system. Okay. And now you please go through when we'll go for next. We'll go for pharmacotherapeutics. Whatsoever topics we have planned, or you can plan it there. Only 9 students I can see who are attended. Please write their names in WhatsApp group who were present, so that I can monitor attendance. Who are they? I can just check it. Who are they? So see that it is there. and if you have any difficulties, you may please ask. So take care, be safe, and happy Diwali to everyone. Most probably tomorrow we may not have a class because from 12 there is a holiday. So tomorrow we may not have a class. You can have a good Diwali everyone, and have a nice festival. Thank you.
तर ते व्हॅनिलोफ्लेक्झिनचं नॅचरल पॉलिमर वगैरे यूज करून. तर आणखी 2 दुसरे पण ड्रग काढलेले होते. ट्रायमिथॅक्झिलिन आणि रोझुआसेटिन. हो सर. नाही सर. नाही. त्याचे मार्केटेड फॉर्म्युलेशन तर फक्त मॉडिफाईड रिलीज टॅब्लेट आणि सिम्पटेड टॅब्लेट आहे. पण त्याचं एक हाफ लाईफ जास्त आहे तर आपल्याला कमी करायची. 7 ते 12 तास. त्याचं GAT मध्ये ड्रग डिग्रेडेशन होतं. हां. त्याचं एक हिपॅटिक मेटाबॉलिझम होतं तर ते अवॉइड करण्यासाठी म्युकोएडिड टॅब्लेट आणि ते अंजनामध्ये यूज करतो. हां.
आपला प्रॉब्लेम सांगणार म्हणजे आपल्याला जे फॉर्म्युलेशन बनवायचे ते काय बनवायचे त्याचं बेसिस
त्याचा एक मी रिलीज लवकर
करायचं.
हां.
आपलं वेगळी गोष्ट आहे, वेगळी गोष्ट आहे. रिलीजचा कशाशी संबंध आहे? ऑनसेट ऑफ ॲक्शन. हाफ लाईफचा कशाशी संबंध आहे? ड्युरेशन. क्लिअर झालं की नाही तुला? हाफ लाईफचा संबंध कशाशी आणि त्याच्या स्टेबिलिटीचा किंवा याचं सोल्युशन कशाशी? आता त्याचा प्रॉब्लेम काय आहे सिस्टीम सोबत तुला काय प्रॉब्लेम वगैरे करायचं आहे?
ड्रग डिग्रेडेशन आणि फर्स्ट हिपॅटिक
मेटाबॉलिझम आहे एक गोष्ट. आणि कसं GIT मध्ये होतं की लिव्हरमध्ये? GIT मध्ये ॲसिड होतं.
हां. गॅस्ट्रोइंटेस्टिनल
मध्ये कुठे होतं? बरं, तू समजा फॉर्म्युलेशन बनवणार त्याचं पॉईंट ऑफ रिलीज काय आहे? कुठून रिलीज बक्कल ठीक. बक्कल बनवल्यामुळे तुला फर्स्ट पास इफेक्ट कमी करणार. काय म्हणायचं त्याचा डोस किती?
त्याचा डोस आहे 35 मिलीग्राम 2 टाइम डे आणि 20 मिलीग्राम 3 टाइम डे.
बरं. मग तुझं असं म्हणणं आहे की एकदा बक्कल आपण हे करणार.
हां.
बक्कल नको आता मार्केटमध्ये दुसरे काही फॉर्म्युलेशन्स आहेत
म्हणजे ह्या ड्रग्स नाही.
हा दुसऱ्या ड्रग्स आहेत.
हो आहे.
मार्केटमध्ये रेडी आहेत फॉर्म्युलेशन. त्यांचं काय कॅरेक्टरिस्टिक्स आहे म्हणजे ते किती वेळ ते टेस्टिंग होतं? ट्रायमिथॅक्झिलिनची टेस्ट माहिती का तशी? बदल करायचं असेल तर त्याची टेस्ट तुला खूप महत्त्वाची आणि ती टेस्ट मास बोलते की नाही ते महत्त्वाचं आहे. हां. त्याचा सगळा अभ्यास कर, सगळं चांगलं असेल तर एका परीक्षणाशी आपण डिस्कस करू. हां, करायचंच करू शकतो. ट्रायमिथॅक्झिलिन काय हरकत नाही.
आणि हे पण पाहिलेलं आहे सर म्हणजे 3 ड्रग काढले होते रोझुआसेटिनचे पण त्याचा पण एक्सटेन्सिव्ह फर्स्ट मेटाबॉलिझम होईल. तो करण्यासाठी आपण
म्हणजे जर तुला बद्दल काही बनवायचं असेल ना तर तू सायमल्टेनियसली याचा पण अभ्यास कर.
हो सर.
त्यांची टेस्ट काय आहे? टेस्ट मास फेल करणे म्हणून. हां सर. आणि त्यापैकी जे काही चांगलं असेल ते बघ. रोजवा मागवायचं असेल तर कोणाकडे मिळून त्याच्याकडे कागदपत्र बनवावं लागतं.
तर